Hello. So we're continuing chapter 15 here, and we'll get now to diagnosing uh, mental disorders or psychological disorders, and also the controversy around that. The stigma that can be attached to diagnosing someone as having a psychological disorder, and a little bit more on the debate, perhaps about just because we say it's a disorder, that doesn't make it so. And maybe we are overdiagnosing people, right? And creating new disorders rather than identifying them or creating them. So the DSM, Diagnostic and Statistical Manual, 5th edition, the DSM-5, is the current edition that we're going off of to list all the psychological disorders, right? Lists all their symptoms, and the DSM-5 is put out by the American Psychiatric Association, so it's very much from the medical point of view. Here, it lists all the disorders that are recognized. It lists all the symptoms of those disorders, and then it's kind of a checklist thing. Maybe you list 10 symptoms of this disorder. The person has to have 5 of those symptoms for 2 months before you diagnose them with this disorder. So it's kind of a checklist type of thing. They have the proper number of symptoms. Do they have they had those symptoms for the specified period of time? And then you diagnose them with that disorder. But those are kind of the guidelines in the DSM-5. But whoever has the authority to diagnose somebody with a psychological disorder can just do it. All right? No one's peeking over their shoulder, making sure they're following the DSM-5 exactly as it's written. All right? So this is where, it's not as objective as you might think. If in order to diagnose someone with a psychological disorder, hopefully the doctor that you're talking to or the clinical psychologist you're talking to is listening to the patient, listening to the client, and has a discussion with the client, about whether or not they think they have a psychological disorder or not, and if they do, which of these might be the better, more appropriate one to perhaps diagnose them with. But a lot of doctors, especially if they're MDs, I'm sorry, but if they're medical doctors, MDs, they see so many patients now. You might see a patient for 15 minutes, and from that 15 minutes, you'll go ahead and diagnose them with major depressive disorder or something. Well, I kind of doubt, right, that you took the time to see the proper number of symptoms for the proper period of time were present before you diagnose that person with that. All right? So maybe we diagnose people too quickly, right? Overdiagnose people when they should not be diagnosed with a particular disorder. But also you have lots of things influencing that, more and more patients, maybe fewer doctors. So, they have to see more patients. Also, you make more money the more patients you see. Also, other money reasons, for insurance or third party payments, which might be insurance or the government. You need a diagnosis for them to pay any money, right? They're not going to pay without a diagnosis. So sometimes you just have to diagnose somebody because that's the only way insurance is going to pay for it, right? Good and bad things about that, obviously. The insurance, of course, wants to make sure there's a genuine issue or problem here before they're forced to pay out all this money. On the other hand, that might be encouraging overdiagnosis. And of course, that's a whole debate about overdiagnosing people, right? So anyway, but once you know their label, right? Once you know what psychological disorder they've been diagnosed with, you pretty much from that can get a lot of information about this patient, right? Very quickly. If you know they're a paranoid schizophrenic, right away you know a lot about this patient, right? You know a lot about the perhaps the future prognosis for this patient. You know the general symptoms that you will expect to see. You also know pretty quickly the possible different treatments, right, to use with this patient. So diagnosing someone with psychological disorder is very useful in conveying a lot of information very quickly to healthcare professionals, right? So that's a good thing about the diagnosis. But of course, there's the stigma attached to the diagnosis, especially if it's a psychological disorder. There's still, for some reason, is still stigma attached to that. If you hear someone has, major depressive disorder, you just think differently about them. You treat them differently. If you hear somebody's bipolar, you treat them differently, right? It's like a stigma has attached to that person, and now we see them as being weak, or they just need to buff up and take care of themselves, and they wouldn't have that disorder. A lot of people think like that. That somehow a psychological disorder indicates a weakness in the individual's, willpower or something. No, it doesn't. It doesn't. So once you get diagnosed with something, it's in your file, right? You're not going to get that diagnosis out of your medical records. Once it's there for your life. All right? It is absolutely there for life in your medical records. Forever you will be treated like that, right? With that stigma attached to you. Of course, we use the word stigma for the negative, evaluations of the person because they have a disorder. But they make it very clear in there, in the book, that, people with psychological disorders are not likely to hurt you in any way. All right? Even folks who have some of the severe psychological disorders, like paranoid schizophrenia, even they are not likely to hurt somebody else. They're more likely to hurt themselves. So there's a much greater chance for all of us that we're going to be assaulted and murdered by a so-called normal person, right, than someone with psychological disorder. That's just the facts. Now, of course, unfortunately, we have these high-profile cases from time to time where you have an individual who had a psychological disorder, do something terrible. But those are few and far between, right, in reality. So really, those who have psychological disorders are not more dangerous than the normal population. They're just not, all right? Then, of course, in this whole controversy of overdiagnosing, do we diagnose too much? Are we, what's the word I'm looking for here? Are we, pathologizing everyday life, all right? Pathologizing everyday life. Are we doing that, right? Are we just seeing everything as a disorder now? And so, we have a bunch of disorders in the DSM-5 that these were not recognized as disorders, 20 years ago. So are we seeing disorders everywhere? Are we pathologizing everyday life? Just because people do stuff in their everyday life doesn't make it a disorder, right? And the example they talk about in the book, of course, is ADHD, right? ADHD, attention deficit hyperactivity disorder, right? So this can be a controversial one. And once again, the debate about maybe we're pathologizing everyday life. So, okay, here you've got a kid, right, who can't concentrate. He or she is always distractible, although there are more boys than girls with ADHD or diagnosed with it. Does this mean we need to label them with a psychological disorder and drug them up because they're hyperactive? Hell, I was hyperactive as a child, right? I made it out okay. So there are people out there that criticize that we're overdiagnosing these kids with ADHD and putting them on medication to help calm them down, which is all well and good, but realize Okay, we haven't been using medication for very long in the history of humanity. All right? You know, I mean, we've been popping pills over, about 100 years, for about 100 years, or maybe a little bit longer than that. What about this medication that we're giving these ADHD children while they're still developing? We have no idea what the long-term effects of this medication is. No idea. It hasn't been, the medication hasn't been around that long, right? So we have no clue what the long-term effects of this, of giving these drugs to people in the developmental period of childhood and adolescence. We have no idea what this is going to do. Oh, but we got to call them, having a disorder because they're hyperactive, and we got to drug them up, right? So this would be an example that the critics say is pathologizing everyday life, right? We're just seeing disorders everywhere. And, so yeah, a lot of kids now go on the ADHD medication, right? It's just like, that's the first thing we do, right? Just a couple teachers just say, or maybe even just one teacher say, the kid won't calm down and pay attention in class, send him to the school nurse, send him to a doctor, get him on the meds, the next week or two. That's our first response to a child that's hyperactive? Right? So critics, jump on this one a lot. And there's some truth to it. Although there's an example in my own family too of I had a nephew who was very hyperactive, didn't do very good in school at all. And once he did get his ADHD medication, he just all of a sudden did great in school, and it really changed things around for him. So I don't know, right? I don't know. It's a hard issue, right? But we need to think about these more often and realize that just because someone's diagnosed doesn't mean they have a disorder that makes them dangerous, or may not mean they have a disorder. Look at individual case-by-case basis is what you need to do, I guess. So anyway, I'll stop this video there.